My name is Dr. Karlis Ullis. I'm a medical doctor. I received my medical degree from the University of Washington in Seattle, and after that I went to UCLA and got further training in pediatrics. And after my pediatric training I went back to Seattle and started sports medicine training. This is a new system. Now, what I'd like to say here is that the Bula Ball system, there's nothing like it right now that I know of, at least in the United States or maybe the whole world. In these DVDs, this one is called Bula Ball, a Bula Ball Method. It's lower back and legs. I've watched it. And I think some of these exercises here are really quite excellent and quite unique in terms of thinking out. I mean, I can see that Riaz Fredericks, who developed this system, has really thought this out, and he also knows his body very well. So you don't see it really, there's a great deal of detail here, but what really is emphasized the most is keeping the core. In other words, keeping the back flat. Don't let your back come, roll in. It defeats the purpose of the whole thing. But keep the core tight. So that's really kind of the new mantra of therapy these days. That's why people do Pilates, is to work the core. And this program really makes you work the core. So that's important. And this is one for the neck, because I really like the neck one, because I have every once in a while neck problem. I sit here with writing all day. I get this ball in the back of my neck, and then I roll on my back and keep my back and keep pulled in here, roll different directions, then roll it up and down my spine a little bit, because if upper thoracic spine is tight, well, your shoulders are going to be tight, your neck's going to be tight. Or then I hit it right back in here, right where the suboccipital area is here, because those are the muscles. If you get those contracted, you're going to have these bad headaches right here, and I've certainly experienced that myself. So when you get that released, you can get rid of a bunch of headaches. So a couple of good examples of where the Bula Ball is really valuable. Post-surgical, low back surgery particularly. People after surgery have so much like tissue contraction, guarding, not psychological guarding, physical guarding. The tissues are pulled. There's a lot of asymmetry, these people. So it's probably not a good idea just to go in there and work on the tissue where you have the surgery, but you actually maybe start away from it and start kind of working at your posture, like maybe start your shoulders, start your back, start your legs, and move up. I think it has a tremendous value for many people, because you can do it on your own at home, and it can really relieve, especially chronic pain. There's so many people in chronic pain, chronic abnormal bad posture, chronically, just not feeling well because they're sitting at the PC all day. The real key thing is to be able to help yourself. I mean, bottom line is you can't spend your life in therapy. You've got to take home some messages and then start being more aware. So this is very valuable for, post-surgery, post-exercise, anybody that's just general good health and general wellness.